Thank you so much for joining us. We are so thrilled about the turnout for this event. For those of you that are able to join us this morning, as well as those that are requesting the recording for later viewing. For those of you that don't know me, my name is Cisa Keller, and I am the president and CEO of Think Small. As always, we want to give a special thanks to Think Small's board members and funders, both past and present, for making all the work that we do to advance our mission possible. Think Small is so excited to host this conversation about a concept, tinkering versus transformation, and a big idea for changing the way Minnesota approaches childcare licensing and quality assurance. To start us off, I will share a bit about the plan for today. Think Small's Candace Yates is going to kick us off with some reflections on where she is in her thinking about Minnesota's childcare licensing and quality rating systems. Next, we'll be joined by Marika Cox-Mitchell, who will share her insights and her viewpoint that a shift is needed. Marika will also introduce a model that could facilitate making that shift. Deb Bliss, who is joining us from Connecticut, will follow to share what her state is doing from a quality assurance perspective. From there, we'll bring in some of our early childhood educators into the conversation and open things up for question and answer. Finally, we're excited to close by hearing from two of our own legislators. We acknowledge that this is a full agenda. There's a lot to talk about. As I mentioned, we will have time for question and answers during the event. If you have any questions, please put them in the Q&A box down on the bottom of your screen. We have disabled the chat feature for this event. Finally, I want to be super clear that this is the beginning of a conversation and that Think Small is facilitating and leading by making space available for it. But nothing being presented today belongs to us and nothing is decided. We'll be posting a recording and sending a survey to attendees following to gather information about how best to continue growing this conversation. And with that, I'm going to hand it off to Think Small's Vice President of Equity and Early Childhood Programs, Candace Yates.
Thank you, Cisa, and good morning again, everybody. Thank you for joining us, and I'm really excited for this conversation today. And as Cisa mentioned, we, both of us and our colleagues here today, are a part of the conversation here with you, and our goal is really to grow the circle about the thinking that's happening around this big idea that crossed our paths this past summer at a conference. But before we jump into that, just want to share a little bit about how that experience at the conference and the information that was shared has really impacted me in these last few months, and how that connects to my journey in the early childhood field. And my hope is that some of you will also be able to relate to that. So I've worked in the field of early childhood education for about 20 years now, which is wild to think about. But I started my journey at the YMCA at the time was Greater St. Paul, Greater Twin Cities, and now it's YMCA of the North, as a teacher, an educator, a trainer, a curriculum coordinator, a director for 10 years. And we had the privilege of participating in the Parent Aware pilot back in 2006 and 7. And my Parent Aware coach is still here at Think Small today, Nina Sutton. I went on to become a Parent Aware quality coach in Anoka County and Washington counties before coming to Think Small. And once joining Think Small, had the opportunity to supervise coaches who are continuing to provide Parent Aware supports, managing the work, growing in my relationship with our state partners and other grantees, and now in my current role in supporting all of our grantee work under our Child Care Aware Services work here in the Metro, around professional development, coaching, financial supports, and language access supports for early educators. So when I walked into that conference and began to hear the big idea, it really connected with me and my experiences that I've had as an educator, and also in coming to what I call the other side of childcare as a coach, and now as a vice president here at Think Small. And a lot of the things that I heard began to really speak to a lot of the questions that I had over the years of why things were structured the way they were, especially coming from a strong child care center background into the work of becoming a coach, I also was really exposed to the world of family childcare that I wasn't exposed to before, and learning more about the relationship between our state system, ourselves as grantees, and our educators. So during this time, and my time in early childhood, I would say that my understanding and my commitment to what quality means for early childhood education has grown. I definitely don't have a one sentence or even a one-page description of what quality is. But what I do believe is that quality is not a destination. It's not a set of standards, or it's not a checkpoint. We won't ever fully arrive at providing quality because our landscape is always changing, family needs are always changing, child development is changing and growing, and we're learning more and more every day. But what I do believe is that quality does require continuous development. It does require an opportunity for us to explore new ideas about how we can best meet the needs of children and families in early childhood education. And quality does ensure best outcomes for our children and their futures. So it's with all of these things that I've experienced that I walked into that presentation at the conference last summer, and that was given by our next guest, and I'll share a little bit more about her later. But it really opened my eyes, and I was really excited to hear what I heard and to start this conversation and to be a part of the conversation. So like I said, I'll let her explain a little bit more fully later, but the basic idea of what this conversation centers around is really pulling back on the current structure that we have right now when it comes to supporting early childhood educators in building quality and maintaining quality in their programs. Pulling licensing back to focus on health and safety, using a national accreditation instead of state-specific quality standards, to have consistent supports and standards for all educators, regardless of where they provide the care, what building they're in, and to acknowledge and value the informal care that happens in our communities. So when I was first exposed to this idea, it spoke to a lot of my experiences, like I shared. From my time working in a child care program, I could imagine the relief as a director myself and my staff that would feel from really having some clarity and simplicity of this change from a licensing standpoint, really having licensing focus on true health and safety. And also from my standpoint of parent aware, seeing the possibilities of having this continuous support from those who've grown up in the field, really helping me and educators to establish, maintain, and develop in that area of quality over time. It's also the case that this idea was reaching me and others at a time when Minnesota is in the middle of two processes. And so we want to acknowledge that we're in the midst of licensing modernization, which launched in 2021 and has not yet concluded, in part due to some sustained and significant pushback from the educator community, and also the Parent Aware redesign, which started in 2022. And while we haven't seen a final plan, there are some concerns about whether we're really going to see true transformation and shift things that need to be shifted here in order to support our programs. So while I appreciate the effort and time that went into these processes and think there are things to take away and implement from both, putting them up against the WeVision approach, it's easy to see that we really could push so much further and get to where we want to get to much faster. As an organization, we at Think Small have had some time to sit with this idea since August and continue to think about how it makes a lot of sense. And over time, we've also been in touch with others in the field where similar themes and ideas have been organically springing up. This conversation is growing, and this week it surfaced at the legislature. CISA mentioned this, but I do want to reiterate that we are predefining we aren't predefining, excuse me, we are not predefining any outcome, and this doesn't belong to us, but we are very committed to raising up this and facilitating this conversation and other conversations like this with all of you, with early educators, advocates, practitioners, policymakers, and others to really figure out how this could work here in Minnesota. we do have a chance to do more than tinker around the edges. And I'm proud and excited to introduce to some of you and reintroduce Marika Cox-Mitchell, who is going to share her vision around this childcare transformation. So before she joins, I'm going to read a little bit about her. Maria serves as the Vice President of Early Childhood at the Bainham Family Foundation, where she leads innovative initiatives to transform early childhood education. With a focus on reimagining childcare systems, Mitchell spearheads the WeVision EarlyEd initiative, which engages proximity experts, families, and early childhood professionals to develop solutions that address the complex needs of children, families, and educators. Mitchell's leadership is instrumental in the foundational efforts to empower communities, address racial and economic disparities, and foster innovative approaches to early childhood care and education. I'm very, very excited to welcome Marika, and I will let you take it away.
So thanks again for inviting me to be part of this conversation around transforming childcare. I think it's important to just note the ways in which childcare has shifted. As an early childhood educator, a trained early child educator, we're taught to observe. And I think if we pause and look at sort of the landscape of childcare within Minnesota across states, we can see that there's a lot of change happening around us. Next slide, please. Which means that for us in this moment of change, means transformation is not a choice. We are receiving increased media coverage, increased public funding, increased private funding, as well as an expanded advocacy base, which is amazing. It's great. It's exactly what early childhood educators and advocates have wanted for a long time. And so I think it's actually a moment to celebrate that we got the field to this level of visibility, which again, like an early childhood favorite, the very hungry caterpillar, we're going to have to go through some transformative change and go through some gooey, yucky cocoon phase. And sort of blossoming into sort of the butterfly. So just again, reinforcing that this change, transformative change in this moment that we've asked for, this moment of increased visibility, transformative change is just not a choice. And I think it's important for us, and I'll say particularly those who are early childhood professionals, administrators and educators included, to lean in and not passively accept what childcare is turning out to be. As one of the early childhood professionals in our work shared, he said, "I do not want to be a victim of the future of childcare. I want to shape it." And in order to shape the future, we're going to have to sort of lead and guide the change happening around us. These three buckets, we talk about childcare a lot in sort of the childcare policies a lot in the context of these three buckets: accessibility, making sure families have access to the childcare options that they want and need for their children, making sure those options are affordable, and certainly making sure they're quality. And across many states, including Minnesota, as we look at sort of the Child Care Assistance Program, the Early Learning Scholarships, VPK, school readiness, it is clear that much attention has been placed on making sure more families are accessible for childcare options that meet their needs, that is becoming more affordable to families, and trying to figure out what is quality in this context. And recognizing that historically, childcare has been extremely fragmented because of the way in which it's been funded at the state and federal levels, where we have these distinctions between Head Start and Early Head Start, VPK and school readiness, Department of Defense and the early learning scholarships and the childcare assistance. So that sort of fragmentation is impacting not only accessibility and affordability, but certainly quality. And so the bulk of this conversation is going to focus more on the quality. I think too often we're forced to compromising and creating a hierarchy. It's a we in this fragmented state, we tend to either prioritize accessibility over affordability, or have to compromise accessibility for affordability, and quality is just always left by the wayside. It's always left as optional. As childcare shifts and we lead the transformative change, it's important for us to look at these three concurrently and make sure that we're not sacrificing quality to make programs more affordable for families or accessible. And so that was the impetus of the foundation launching the WeVision, the Bainham Family Foundation launching the WeVision EarlyEd initiative. We are an early childhood funder. We've invested in our first decade in this early childhood space. We invested more than $50 million in this space. We've learned a lot from our partners. Our partners, like you all have been saying to us, we appreciate your support. However, we're not getting to the ideal. We're not leaning into transformative change. We're simply scratching the surface. I appreciate your funding and your resources, but you're not challenging the status quo. And so we committed to listening to our partners and pushing for the transformative change they've been asking for, and recognizing that systems change is going to be required. And so WeVision EarlyEd is listening to those who are most proximate, early childhood educators, administrators, and families, and ensure we're clear about what do they want to see in their transformative ideal childcare and our commitment to making it real. It is clear, just looking at the data from these proximity experts, that we're all going to have to do some change. That for this transformative change to occur, we're going to have to go from the egg on the leaf to the caterpillar, get in the yucky cocoon for that butterfly metamorphosis to happen. And so parts of the change is going to be comfortable for some, and parts will be uncomfortable for others. And as futurist bell hooks reminds us, that we're going to have to imagine it so that it comes into being. What we cannot imagine cannot come into being. And this is the emphasis of this set of national initiative. It's like, what is the ideal childcare? What does it look like? How do we make it practical and concrete? So we've been pulling data from these proximity experts to make that more practical and concrete. And so as an example, here is sort of getting clear and options for families, right? Challenging the fragmented way in which we have been defining childcare, right? Families said in the multiple focus groups we've had with them, it's really confusing to figure it out. There are just too many siloed systems. I don't understand the difference between all the star ratings, and then there's VPK, and then there's centers, and then there's homes, and then there's FFN. You guys are throwing too much at me. I need to make sense of all of it. Same with the educators. They're like, I don't know what credentials or degree to have. Everyone is asking me for a different requirement. Administrators are saying the same thing. I can't even recruit competent early childhood educators because I'm in this fragmented, confused, a system that's quite confusing. And so as we transform, how do we get clear about these options and ensure that these options are equitably funded? And so in the WeVision EarlyEd construct, you see there are pretty much two types of childcare: early childhood education and trusted caregivers. And these two can coexist. Early childhood education programs can exist in homes, can exist in centers, can exist in schools. The early childhood education programs meeting the baseline quality standards for early child education and receiving comparable conversation. This is a way of decoupling the building type or the funding stream from the activity that's happening in the space. And then trusted caregiver for some families in our work, from the data we're receiving, families like military families, some families with medically fragile children. They're like, I prefer the trusted caregiver option. I love the fact that there's an ECE program, an amazing center a mile away from my house, but that does not work for me. My family's too transient. My child will be in an new early childhood program every 6 months because of the nature of our work. So I appreciate it, but that option doesn't work for me. I prefer a trusted caregiver option. And so we're showing that these two options can coexist. But as it relates to quality, again, early childhood education programs are all meeting the baseline quality standards for early childhood education. And as you can see, the funding stream there isn't highlighted. So here's what it looks like explicitly for the early child education program, which is not the same as a trusted caregiver. Trusted caregivers practice with autonomy and sort of in some ways self-regulate. For the early child education programs, as you can see, this is right sizing quality. It is not suggest that quality is not important. Quality is important, but it needs to be streamlined and right size. And there's a role for government and there's a role for the profession and professional associations and accreditation in this transformative construct. You see that government is responsible for creating a baseline facility safety standards and monitoring that to make sure the spaces are safe for young children, physically and emotionally safe for young children. Government is also responsible for making sure there's funding in place that covers the baseline, that addresses the accessibility and affordability. And when it comes to the baseline, early childhood education program quality standards and monitoring, that is done by an industry recognized professional association, typically accreditation. So everyone has a role. The early childhood education profession is respected as an entity that is not a blank slate, that comes with its own set of standards and codes and regulation that's always continuously updated and maintained by early childhood educators. And again, the government has a role in making sure the facilities are safe and they're providing funding. And certainly you can add other specialized standards and funding on top of that, but I think we need to just like give the field a solid baseline before we start adding specializations. In this field, it seems as if we're specializing it without a baseline, which makes it really challenging, and making sure that this baseline applies to all programs, regardless of the funding streams or the building types. In many ways, what can seem transformative to early childhood education or our childcare sector is the norm in other sectors. So for example, I was looking at sort of the child birth center licensing regulations in Minnesota. I was looking at sort of the Board of Nursing regulations and the regulation of other professions and other spaces. And you see accreditation explicitly listed in all of those regulations. You see the industry recognized professional associations, whether it's the exam, their accreditation systems, their standards, their code of ethics are explicitly listed in there. So this whole governance structure where there's no unnecessary duplication occurs in many other industries and other professions. I think we need to learn from those other industries and professions as a way of streamlining, modernizing, and right-sizing regulations. I think it's also important to recognize that the future is already happening. At the Bain Family Foundation, we are also committing to making the ideal real so that it's not sort of these sort of pie in the sky ideas. It is clear that the ideal is possible. We're currently funding 22 sites, 22 lab sites. We call them the WeVision EarlyEd solutions lab sites, who are doing exactly that. And we're funding them in that exact same way. We're saying, go meet your industry recognized quality standards, which is accreditation. In those entities, sites are selecting theirs. Typically, it's NAEYCs, NAFCCs, Montessori. Some are Head Start and trying to figure out like what that means, right? Make sure you're meeting your state licensing standards. and we're going to reimburse you at the true cost of quality and make it affordable for families, frankly, regardless of their income. But the only way we're able to invest heavily in affordability, the only way we're able to sort of reimburse at the true cost of quality, which allows those sites to compensate the early childhood educators using K-12 wages as a guide, is because we streamline regulations and leverage what already existed. We did not develop WeVision quality standards. We did not develop WeVision monitoring protocols. That would have cost us significant funding. And so we redirected what we would have typically done in the early childhood space by layering on yet another set of standards in an already fragmented space. And we redirected that to quality, giving it directly to the providers for quality and affordability. So the future is already happening. Again, like I mentioned, that's kind of what it looks like for these solutions lab sites, making sure that we're not losing quality in our requests to support affordability and accessibility. They can all coexist, and we can define a true cost and reimburse on the true cost. We can compensate early childhood educators in part because we're leveraging the industry recognized and holistic quality standards that already exist. And again, trusted caregivers can be a part of this more cohesive childcare system, but making sure we're not wasting significant resources on trying to figure out how to regulate a stay-at-home parent, or how to regulate nannies, how to regulate community members who are like, I just want to trust the caregiver options. And so they're getting some stipend and support, but the regulations look significantly different. So that's all I have to share about WeVision EarlyEd. Again, it's a time, space, resources for us to do some transformative thinking around childcare and demonstrate, frankly, that the ideal childcare as defined using data from early childhood educators, early childhood program administrators, and families can be made real. I often say that simplicity is going to be the innovation in this space. And it sounds simple and boring, but that is where the innovation lies. How do we streamline and make sure we can focus on quality, accessibility, and affordability?
Thank you, Marika. Even though I've heard your presentation, I get excited every time, and I am to think about. So I really appreciate you sharing this. And as we move on and prepare to hear from our next guest, I just want to highlight a few things that were shared that just really stood out for me, and hopefully you all are taking notes as well. But really, one question you posed as you were sharing was, how do we get clear? And I think that is something for us to keep in the forefront of our minds as we think about this model and the opportunities we have in these conversations. That this isn't about sacrificing one aspect of providing care for the other, right? This isn't, when we think about accessibility, affordability, and quality, the focus is not about sacrificing one to accomplish the other, but how can we do all of those things? We are right-sizing our approach, and the baseline that Marika shared in the model really helps support uniqueness that we all want to see in our programs, and we know that our educators want to provide in how they care and educate our children. And one other thing too, in looking at the model, when we talk about a baseline, baseline does not mean basic, right? A baseline does not equate to the minimum, but what we have learned in our learning is necessary to provide quality early childhood care and education. And that there's other industry models that we can look to and learn from as we continue to have this conversation and think about what this looks like here. And as we move into introducing our next guest, for us to realize that the possibility that we're hearing about is becoming a reality, right? The future of this is already happening. This is taking place, and we're here to learn. And Marika, and I'm gonna switch to introducing another guest here who is going to talk about how this is being operationalized in a model that matches up with a lot of what Marika shared. Deb Fliss serves as the Director of Quality Improvement at the Connecticut Office of Early Childhood, bringing extensive experience in early childhood education to her role. Her expertise spans program quality assessment, accreditation, facilitation, and professional development for early childhood educators. Previously, as the education specialist for program quality and accreditation at the Connecticut Accreditation Facilitation Project, Fliss played a crucial role in elevating the standards of early childhood education through Deb.
Thanks, Candace. Good morning. I'm happy to be with all of you today. I appreciate the warm introduction, and just want to say that if any of you see my cousins in the Minneapolis area today, please give them my best. I'm happy to have a little touchstone to family today through this. I'm here today to present our system as a concept from which you might consider your transformation, and to think about ways that we may have leveraged our change process that could inform your change process. I expect that we will learn from you too as you continue to engage in your transformation. I'm privileged to work for a gifted and visionary leader in our Commissioner, Beth Bai, and we have used and leveraged her vision and our experience in our state with accreditation to develop our quality improvement system, Elevate. I want to be clear that Elevate is the 5th time that we worked on creating a quality improvement system. The previous 4 iterations resulted in 1 pilot, but never full implementation. And so Elevate, as I'm going to describe it now, next slide, please, Emily, is the system that we have had operational since July of 2022. We crafted our system during COVID. We were forced by the circumstances of COVID to change and adapt our plans to what providers were experiencing. We were able to gather lots of provider input into our work, and what you will hear about is informed by their needs, their voice, and their vision for what our system could look like. As I said, we launched in July of 2022. We started accepting applications for Member Plus in August of 2023. So I think you might equate us to a toddler about ready to become a preschooler in terms of the longevity of our system. We offer 3 levels of engagement, as you see on the screen here. The member level is licensed and license exempt providers. This is our baseline for entry. We leverage our licensing system here as the monitoring for providers at this level. The second level is Member Plus, which is those providers who have moved from Member to Member Plus by submitting a quality improvement plan that we call an Elevate program plan. Since August of 2023, we have approved 282 providers who've gotten to the Member Plus level. This level also includes the submission of a professional development plan and a program professional development plan as part of their work, so that we are looking at both the individual program improvement as well as being aware of what the program is planning in terms of developing its staff. And then our third level of engagement is called Member Accredited. This is programs that have committed to NAEYC, NAFCC, and or Head Start, Early Head Start approval. We have about 600 programs at Member Accredited level. It's important for you to know that we have been invested in NAEYC accreditation since 1989 through state legislation for our funded programs. And so that has long been a driver and an influence on our system and our system building. So here's just a little bit of background about our system. Everything that we deliver is free. We are very committed to using existing infrastructure. Programs make choices about how they engage with us. We did put all of our license and license exempt providers in our system as members, but they choose the timing and whether or not they will advance. We are committed to using national systems as our infrastructure. This is informed by some work we did in late 2019 and 2020 to look at some of the build initiative reports around quality rating and improvement systems, and they were at that time identifying the very high cost of implementing those systems. So we did a little research. We found in their reporting that about 33% of all of the funds that had been used by states for quality rating and improvement systems were actually supporting infrastructure such as the rating process and management and communication. And that meant that that money was not going directly to providers. And we wanted to be cautious about that. So we extrapolated some of the build data and came up with a total of $1.063 billion in quality rating and improvement system funding that had been used for infrastructure building, and decided that we would commit ourselves to trying not to build an infrastructure that was larger than the support system that we were delivering. So, next slide, please. A little bit about what our system is and what it is not in terms of how it's different from what historically has been quality rating and improvement systems. We're focused on support. We work hard to sustain businesses as they deliver services to children and families. We work very hard to be inclusive of all provider types and to ensure that our supports are available and accessible to all providers. All of the support that I'm going to tell you about today is free of charge to providers, and our system is designed to support providers to move from licensing to accreditation. We're not a star system. We're not a rating system. We don't have mandates for provider participation or time frame that they must participate. So we look a little different than a lot of other systems, including that we call ourselves a quality improvement system. There's no R in our description of ourselves. And we're ultimately focused on improving quality at the direct service level so that we are touching children and families. This is a slide that just gives a quick view of all of the benefits of our system. I'm going to describe some of them in a little more detail, but it's important to look at this chart and see the number of opportunities that providers have to access quality improvement. We work hard to bring these supports to the table for providers to help instill a quality improvement mindset in our technical assistance providers and in our provider community. Next, I'm going to tell you a little bit about some of our largest professional development supports. We have a robust accreditation quality improvement system. As I said, we have been committed to NAEYC accreditation legislatively since 1989. We also have a new-ish staffed family child care network system. That system's been emerging since 2017 and is a statewide, state-funded system now for all family child care providers to access. Our quality improvement system is implemented by a team of service navigators. Those are five individuals and a manager who implement supports to our provider community. They are essentially the connective human tissue between staff family child care networks, accreditation support, and all the professional development that you see outlined at the bottom of this slide. Service navigators help guide providers in accessing the resources that they need to make improvements that they choose to make. Our accreditation quality improvement system is the largest part of our facilitated support for providers. We currently have 491 accredited programs representing about 528 sites. That's NAEYC accreditation. We're usually the leader in accreditation. I don't know if we actually are right now. This system is managed by a 0.5 of one full-time employee at our staff and contracted out to 6 other entities to provide regional support across our state. Programs that engage with accreditation support have access to individualized technical assistance that helps them make their plans and implement the steps of the accreditation process. Also, for all programs in our state, office hours are provided and professional development is provided to help providers learn more about the system, understand what accreditation has to offer them and how they can engage, and professional development that helps providers learn more about the best practices of NAEYC accreditation, of NAFCC accreditation standards, of Head Start standards, so that providers can be incorporating those best practices into their quality improvement plans. We use accreditation as our accountability mechanism. We are essentially using the national bar for quality. We are leaning in on the reliable trained assessors in the accreditation system. We use the documentation of the decisions on accreditation to feed providers' continuous improvement plans. The random unannounced assessor visits in NAEYC accreditation are important to us. Excuse me. Sorry. Thanks for the pause. Random unannounced assessor visits are important to us because they are a way to help providers be aware of their continuous responsibility and opportunity to meet standards. And we use the system to ensure that programs achieve and stay at a high level of quality and stability. We also use NAFCC and Head Start in our accreditation system and lean into those systems in the same way that we do to NAEYC. So I want to tell you a little bit more about our Member Plus level. Programs that are pursuing Member Plus, moving from the level of member to Member Plus, work on a program plan. That program plan has a focus area. We have 5 focus areas in our system. Providers write SMART goals. We provide technical assistance to help them define and write effective SMART goals. We support their action steps and we help them track their progress toward achieving those goals. When a provider achieves Member Plus, that plan is valid for a year. When they come back into the system, we ask them how their previous plan connected or informed their future planning. So again, we are trying to cement and support that continuous quality improvement strategy. All of these plans are submitted electronically. We have a platform called OEC 360 that has a lot of data about what we know about our providers that providers can see easily in one place. And the submission of the Elevate program plan is the first place in our OEC 360 system where providers engage by submitting information. They submit their plans, we review them on our side to make sure that they've achieved the goals, and then they are approved and become Member Plus. I should also tell you that for the first year or so of operating our Member Plus system, we offered an incentive of $1,400 for providers who achieved that level, and that helped us move those 282 programs forward. This is just a sample of some of our social media postings that our agency has used to both promote our quality improvement system and to help providers and families know a little bit about the system and know that we are working on and committing toward continuous quality improvement. So just a little bit of summary in terms of lessons that we've learned that have been important to our transformation into a supportive quality engagement system for providers. We have leaned hard into the idea of investing our money in providers. We did not build infrastructure intentionally so that we could use that funding to support providers in the various professional development opportunities that I've described for you, and to make sure that providers are able to access the kind of professional development that connects to their needs and the places that they want to make improvements. Facilitation makes a difference as a system level support. It creates relationships between technical assistance providers who can be helpers to the quality improvement process. It ensures that expertise is available to providers when they need it, to guide them through the system, to help them understand the change process, and to help them move forward on their goals in timely and efficient ways. I will tell you, though, that every program has its own journey on accreditation, but I think our numbers prove that we've been able to support many different kinds of providers through the accreditation process. I worked in accreditation facilitation for about 20 years, and I've seen programs go through the process very quickly, 6 months. I've also seen the longest duration of accreditation process in my tenure was 7 years, but that program got there and they're still at the accreditation level. So I think it's just evidence of the fact that PD supports and expertise needs to be brought to bear when programs are ready in ways that it meets provider needs in order to help them get there. I think our average is probably about 2 years for the accreditation process. And then lastly, what I'll say about lessons learned is that we work hard to resist the urge to build what already exists. The national systems make a difference. We use our licensing system as our baseline, as the foundation from which providers begin to move forward on a quality improvement journey. We are fortunate to have high licensing standards that help us align with national standards, and we leverage that for providers so that they can see how they are already meeting national standards and where they can use new information from standards to move forward. The last slide is just my contact information and our website information if you're interested. And I'm happy to answer questions and talk more about our system as it's helpful.
Thank you, Deb.
Thanks, Candace.
Yes. And again, definitely took lots of notes, and I hope others did as well. We are going to transition into hearing childhood providers here in Minnesota who are going to share some of their reactions and feedback about this new idea and what they've heard today. I just want to also share that we did plan to have Nakia Howard, who runs a licensed family child care program, join us today, but unfortunately her helper's out sick, so she is providing direct care, but she wanted us to let all of you know that she is very supportive of this idea. So I'm going to invite our first provider, Maria Harms, to share a bit about herself and her program. Welcome, Maria.
Thank you. I'm happy to be here, and I just thank everyone that are working so hard to shift the system that so desperately needs it. I am thrilled to be a part of it and appreciate the conversation if anyone wants to have it. So we had a couple questions that we were asked to answer. Sorry, before that, I am a child care center in Redwood Falls, Minnesota. We are a population of 5,500 people. My center has capacity for 74 children, 42 under school age. And I opened in September of 2023. Prior to that, I was a director for a certified exempt center, a private nonprofit center, a public center, and a private nonprofit. So I've kind of been in many roles and seen the industry in many areas. I was also a family childcare provider prior to jumping into the center roles. So current licensing standards are a heavy burden for providers. This new idea reduces the regulations, which is paramount to the industry. Providers are leaving the industry at alarming rates, and the new regulation modernization project is not solving the issues. Quite frankly, they're just adding more regulations and making it harder for providers. And the added regulations don't make things any safer or healthier for kids. And I think that's where the gray area exists, is what is safe enough and what is healthy enough. And similar to the quality, we never hit quality, we never hit safe, we never hit healthy. We can always do better. But where is that line to make it practical for people in the field and professionals doing the work?
Mhm.
My center currently does not do accreditation because it feels like an overload of things for my staff to do and stay on top of. So I've chosen not to do that. This platform would allow us to join in on accreditation and have that working relationship with those different organizations. Something else, a lot of people just don't see it. This is the book of current regulations, and it's very, very thick. There are very many pages, and more pages than other industries. Some comparisons is the nursing homes and even family childcare providers in the same industry don't have the same regulations. So this model puts us all on the same playing field in some aspect. What do we
Mhm.
see as potential benefits of separating aspects of quality out of licensing and instead looking to national accreditation for those standards? This will allow for provider choice of what type of accreditation they will seek out, allow for providers to better differentiate from one another, and will allow parents more choice in having a differentiated program. It allows a needed refocus to be on the health and safety of children and not the micromanaging of day-to-day operations of a facility. This will actually make us want to seek the accreditation, as I spoke on before, just due to us having the capacity to take on more information in those quality initiatives instead of just focusing on all of the strenuous licensing rules. Lastly, what kind of quality improvement supports would you like to see to help providers make this kind of shift? This shift would be pretty freeing, but also a little bit nerve-wracking, honestly. For those of us that have been in the industry for so long, we're so programmed to have all of the regulations memorized and working in our facilities. I feel like we'd need a little less therapy if this was the model that we went off of, which I'm kind of kidding, but the quality improvement supports would need to be with whatever quality improvement route providers take, just to have that individual to ask questions to. And while we're all in that mind shift, just supporting us along the way to let us know, nope, we're actually doing what we're supposed to be doing. You don't have to worry about, having 48 blocks in your room at all times. After your little toddler put one in their mouth and now you got to go hunt down another one, instead of actually providing the quality to the kids where you're building with 12 blocks at a table with 4 students and actually scaffolding their learning versus counting blocks. So that's just an example. There's many more. I could kind of go off on a soapbox, but I very much support this and I'm excited to see where it can bring the industry, as it is one that is seeking change. So
Yeah.
excited to be a part of that.
Thank you, Maria, for sharing and really sharing, the reality about your day-to-day work and how the new model could support you in providing really quality care and also really support you as an educator and your staff and their well-being too, because that is something that Marika did point out in the model too. And when we think about this model is how are we supporting our staff to provide that quality care? And so what I heard you say is, again, the question from earlier, how do we make things clear? So when things are clear, you're able to do your work better. Your staff are able to do your work better, and which means providing quality, meeting the requirements, and also doing it in a unique way that you feel serves your staff and your families best. So I appreciate you sharing. I'm going to invite Christina Valdez to join us as well. Christina is also a administrator of us. Let you share a little bit about yourself as well, and then we can also walk through some of the same questions that Maria gave us feedback on.
Hi, so I am Christina Valdez. I'm the director of Listos Preschool and Childcare. We're a bilingual Spanish and English program in Rochester, Minnesota. Forgive me if my Zoom is going very slow and I'm glitchy, so just let me know if it freezes. But this is a second career for me. I am the founder of our program, and I did it when I was pregnant with my first daughter. My husband is from Mexico. We needed to raise her bilingual, and there was nothing of that sort here in Rochester. So I really started this program with this ideal of making this amazing space for children like my daughter that need to grow up bilingual and want to grow up speaking two languages. But then as I went back to school for early childhood education and learned a lot more, it was like so amazing. And then when I got started, like the reality hit, like, oh, it's just so much paperwork and just really tedious information that isn't really like the heart of what we want to be providing the children. And that was kind of the main focus. So those first few years of being open, we're in our 10th school year now, we're really a struggle of keeping up with everything. And keeping the staff motivated to be able to do amazing work with the children on top of all the regulations. And I think that these are great changes that we're looking at possibly making here in Minnesota because so like we're licensed in many ways, not just the DHS licensor. So we also do have a county inspector who comes in to check our food program, how we run our kitchen and the meals. And so when she comes in, she has a very detailed list on an iPad and she was able to go through, take the temperatures. I know in advance what information she needs from me, what checklists that she needs me to be able to show that we've been completing, the trainings that my staff have, and the supplies that we have on site. It's a very beneficial relationship because she brings me information. She's like, look, I have new posters in Spanish that you can hang. So it's a great licensing relationship with our food inspector. And so it always seems like, oh, an inspector would be bad, but no, I enjoy it when she comes. I do not have the same joy, even though I have a great relationship with our DHS licensor. It is more of a worry of what punitive things we're gonna be checked off for. This recent one was package of wipes was in a child's cubby. And so we have a licensing violation for having hazardous objects accessible to children. So I was like, oh man, we're trying to do all this great work and this is what is published on the DHS website for our program. So yeah, being able to take those next steps to be able to build up amazing programs is really what we can do in Minnesota. And I love that analogy with Hungry Caterpillar. I mean, I feel like we're not, yes, change is hard, but we're as early childhood providers are not scared of messy and difficult. We went through COVID. We, were innovative and adaptable, and we were able to stay open and keep the children safe and healthy during COVID. So we can do a lot with a little, but when we're given the resources and the expertise and the coaches, we can do a lot more. And really that's going to make huge impact for the children and the educators and then the families too, to be able to have a diverse selection of places that will best meet the needs of their children.
Yeah. Can I'm going to ask you one question before we move into a Q&A, just to kind of hear your thoughts. Maria shared on this a little bit. Christina, what do you see as the potential benefits of separating aspects of quality out of licensing and instead looking to national accreditation specifically for those standards? And like, what would that look like for your program?
For us, now that we're in our 10th year, we are starting to look at that national accreditation. So we waited slightly because NACCE was changing their model and they just came out with this new model in March. And so I'm like looking at it, but it is a huge load to add on top when we already have a lot of standards to meet. So that's why it's always been kind of daunting. So if we're able to like cut out those licensing regulations that they should be like the minimum of what we're meeting. The quality should be what we're like striving for. So if we can, have those like very clear, very, easy to understand for the providers and the licensors, exactly what we need to meet, be able to meet those clearly and easily, and then be able to focus our time on quality and be able to go through, like I have my printed checklist of what I need. And for an AC, and we're only looking at, they have a new like lower level of being recognized. And so like it's a multi-page thing. And so yeah, having somebody who could kind of lead us and coach us and make sure that we're doing that high quality education. I mean, that's what we've always wanted to do and strive to do. So having that, you know, accessible and available to us, great.
Great. And kind of going back to what you said about having your food program manager come in and to assess the food program, kind of what I heard you say is like they like your program in a very specific area of expertise that they are meant to come into, but they're not necessarily what specific food is tastes better for your children in terms of the quality, right, of what your children would be receiving, this type of meal versus this meal. But of the meals that you're providing, are you meeting the regulations as it's dictated in the food program? But if your program thinks that your children would love carrots better than green beans because you're working on colors, that's not their job, right? Their job is to make sure the temperature, portions, sanitation, all of those things. Above and beyond that, when it comes to the quality and the presentation, that's something different. So appreciate you also for joining us short notice and sharing your thoughts too. And thank you, Maria. We're gonna transition now. We see some comments that are in our question and answer box here. So we're gonna bring back Marika and Deb as well and spend some time taking questions. So if you haven't put any questions in the question box, feel free to pop in and drop some questions in there. And we are gonna take some time to answer them.
I'll take over from here. Hello,
I'm sorry, I forgot
No,
to
that's
introduce
okay.
you. Yes.
No worries, no worries. I'm Dr. Nicole Sperullo. I'm the Director of Data Research and Policy here at Think Small, and I'm here to facilitate your Q&A. I want to thank everyone so much for being here. I've really appreciated hearing from you all. I too have heard Marika speak multiple times, and each time I glean a little more. Few more nuggets. This time in particular, Marika, I really appreciated that you said by streamlining regulations and utilizing what already exists, that allows us to pay for the true cost of quality. I think that's really important to remember, that when we create efficiency within a system and we streamline it, that frees up resources to do things that are going to truly pursue what we're interested in, which is true quality and the cost of that. So in our Q&A, we have a few questions. I do want to share one that was responded to. Someone had asked of the Connecticut program from Deb, what is the percentage of childcare programs in Connecticut who are accredited or in each tier? And she shared that about 35% of the center population is NACE accredited. For family childcare, it's about 1%, and support for that process is newer, but they've been seeing an increase in providers that are pursuing NAFCC accreditation, and that about 20% of providers are at Member Plus. So to kind of follow up on that, Deb, you mentioned that there's no time limit on when providers need to move from Member to Member Plus. And I'm just curious, does that mean people who don't decide to move to Member Plus, like that they can stay as member indefinitely? And then what does that do about incentivizing or disincentivizing the move from Member to Member Plus? What's been your experience with that?
Sure. So yes, they can stay at Member Plus. They have to renew though. So they would have to submit another plan and all the associated professional development plan. If they are a center-based program, I should say the family childcare providers just do the Elevate plan, because obviously a plan for a family provider is also their professional development plan. They can remain at that level as long as they choose. Programs at the member level are not required to do anything beyond maintain their legally required licensing level or legally exempt level. So that requires no action. I think we're too new to say what that means over time, though we are collecting data on that and we are watching how providers move from one level to another. I think it's also important to say, and I think there's another question related to families in here somewhere, that the Elevate level is published on our CCR&R pages. So if you search for childcare in our CCR&R, you will see the icons that I showed in the slideshow next to each provider, and you can, as a family member, you can click on that icon and it will tell you what it means. There is also then a link to our page that explains Elevate for families, and there's a one-page flyer for Elevate that a provider could share with families as well. So we have had to recognize that we are first and foremost a system of support for providers, and we are just now beginning to lean into the family side of information. But as providers engage with the system, again, they make their own choices about moving up, and we will continue to offer them benefits as they advance through the system. I should say we pay accreditation fees for family childcare and for center-based providers, including renewal fees. Our subsidy system for families receiving childcare subsidy pays a bonus for each child who is enrolled in a program that is accredited. So for a center-based provider who serves a family in our Care for Kids subsidy system, they get a 25% payment bonus for whatever that child's subsidy payment is. And family childcare gets a 12.5% bonus for being in an NAFCC accredited program. So there is additional money on the table, which helps providers make their improvements, but it also conveys our message of importance about meeting best practice national standards.
Thank you. Okay, there's another question in the chat I just want to quickly address. Is Minnesota trying to implement this for our childcare business? No, this today is just a conversation talking about a big idea, talking about the potential for the future. So none of this is being implemented. I just wanted to make sure we reiterate that. So there's some questions about how this system addresses low worker wages and that true cost of quality. I'm wondering if anyone could share a little on that.
Okay, I'll go first, then you go. Okay, so as I just described the bonuses, I want to be clear that our subsidy system is a way that we are adding increased funding to the childcare community. That over the last 2 years, this year marks the third consecutive year of increases in the amount of subsidy paid through our subsidy voucher system. So we had 11% increases over 3 years. We also have the bonuses that I just described. So that is the way that we are getting more money into childcare providers' businesses. We are not dictating compensation levels at this point. We are talking about that going forward in our funded programs, but that would require us to raise the rates that we are paying for spaces in our OEC funded programs. Okay, I'm going to stop there and let Marika chip in.
Yeah, and as so WeVision EarlyEd, it is demonstrating that the ideal childcare as defined by families, educators, and administrators is possible. And so as a result, we're reimbursing at the true cost of quality. We're streamlining and right-sizing regulations, and that allows us to also hold those 22 sites that are piloting this future accountable for meeting, aligning with K-12 wages and explicitly addressing educator well-being. So that's part of the funding formula. But again, that's only a part of the funding formula because we're only pretty much 2 FTEs running this national pilot. If we had to hire our own researchers and quality assurance like that, we would not be able to afford that. So that is baked into the model as we demonstrate that the ideal is possible. So it's some time to get to it, but it is definitely possible.
Okay, and I do want to mention there's a lot of questions in the chat, and if in the Q&A, if yours doesn't get responded to, we'll be working on responding as we move forward, perhaps putting something up on Think Small with answers that we didn't get to in this session. But I do want to pose one last question to the group and also give our providers an opportunity to respond. Marika offered the metaphor of a gooey, yucky change, which I absolutely love. So I'm wondering what each of you sees as the biggest challenges in a process like this. What do you see as potential barriers moving forward with people in the field?
I will say letting go of the silos and the way in which we self-identify in this space where we are fragmented because of the way in which we're funded. And this idea that we feel like we're so different across funding streams or program types, and recognizing that all early child education programs, while they may have some contextual differences, some curriculum differences, their building may look different. They may be have a different business model, that we're all experiencing some of the same pain points and all want the same ideal. And so just being able to let go of those imposed silos so that we can sort of dream big together is just one to highlight.
Nicole, I'm going to say two things. The first is communication. At the point where we are in our development of Elevate and its implementation, it is a communications project as much as it is anything else, helping providers understand the opportunities, the resources, the professional development, and making sure providers have feedback loops to tell us what they need, what they want, what's helpful, what's not, where they want to do work, where they don't, all of that. We have to be good communicators and better listeners. Then the second thing I'll say links to Marika, and that is we need to get to a real sustainable business model for this work. And compensation obviously is a huge part of that. But there are other pieces of that as well. Providers really knowing and understanding how their business functions, where their money is, making sure that they are accessing the benefits and resources that they can that help alleviate cost in their business. Shared services models can help with that. We have tried, not to tremendous success though, to implement things like shared service business models. So really working on business supports that help providers feel like they are not living a day-to-day, do I have enough funding to support my staff, to keep my business open, to make sure families are getting what they need from us.
Christina, did you want to share?
I was just going to say the biggest thing will be meeting each childcare provider, centers, family care providers at where they're at, because we're all on different paths going forward. And we have high turnover of staff, and how we're going to be able to keep that up with the staff turnover, because we don't have the compensation and we also don't have the healthcare and everything in place to keep staff long term. So it's be able to keep up that quality and meeting us where we are to help us.
Great. Anyone else have anything to share before we pass it back to Candace?
I have one quick, just overall, childcare is the backbone to a working economy, and what is currently out there is not working. And if we don't find a new way to articulate this system, there will be no system, and that will have traumatic reactions and responses. And if you don't have a child in childcare, you should still care about childcare, because your jobs are directly affected by the access people have to childcare. And I think this model is so important to give parents back their voice in what they want for their child and where they're going to send their child, knowing that the licensing rules are based on health and safety. and not all of the things that can differentiate one program from another. And that's where the accreditation piece comes or doesn't. And the provider has the ability to choose that. And that's empowering because those people either invest in that or they're happy where they're at, and parents can choose to be okay with that. So this is a step in the right direction and is helping providers, which is not necessarily always the case. And health and safety is very important, but so are the people doing the work. And if there's no people doing the work, there's no care for children. So.
Wonderful. Thank you all. Well, to kind of wrap us up, we are excited to bring Representative Nathan Coulter to the conversation. Representative Coulter is a DFL member from Bloomington, representing the Bloomington constituency, and has been a member of the House Children, Families, Finance, and Policy Committee for a bit here. And he brought forward a bill in partnership with Representative Danny Nadeau this week around this issue, and it actually had a hearing. So first, thank you so much, Representative Coulter, for joining the conversation. And I guess I just have a question for you. You know, what about this idea really made you want to work on this particular bill?
That's a great question. And first of all, thank you all for having me here today. And I am really excited about the future of childcare licensing in Minnesota. I think you all know we've kind of worked on this for a while, and I think we have a really good path forward for really putting in place a system that's going to just make things easier for everybody. So to answer your question directly, you know, I would say on my part, the sort of genesis for this came kind of last year as I was, or even year before that. But as you know, we were kind of getting more into the work of the regulation modernization project, and I just sort of, excuse me, had this kind of realization that, you know, that childcare exists in this sort of weird nexus between human services and education. And I think as we learn more about early childhood development and you know what our youngest kids really need, I think to me it just became very clear that we really need to license providers more like educators, because that's what you are, right? And so that to me sort of that kind of led me to this thought process. And then Erica brought up this model that some of you had been talking about, and she did so at one of our committee hearings. And afterward, I literally went up to her and said, I did not give her the option that we would be meeting and we would be talking about this. I think that's just kind of where this work came from. But I think it really gets at that important piece, which is recognizing that you are all educators and recognizing how important the work that you all do is as educators, and really doing what we can to sort of center that importance and the joy of that work.
Wonderful. Thank you. As you mentioned, this did get, you know, it did have a hearing this week. How did that hearing go?
I mean, it just went phenomenally. It was really one of the best hearings I think I've seen in 2 years working or being in the House and 10 years working at the Senate. There was just, you know, universal support for the concept, and we have, I think, that's my phone. We have, you know, significant bipartisan support, and I think significant recognition that you know, the advantage of this approach, this model, is that it doesn't just sort of hack off regulations for their own sake, but really focuses on what is the purpose, what are the regulations trying to accomplish here, and then, you know, from there, what are the better approaches that we can use to get at quality, to get at you know, sort of the education piece of it, so that, you know, when licensors come and when folks are concerned about what they're being licensed for, that they can focus on those things and not have to be distracted from doing the work that they're otherwise doing.
Yeah, wonderful. And I would like to, on that point, as you were mentioning, this has broad bipartisan support and bicameral support, both in the House and Senate. I do want to mention that we had originally Representative Danny Nadeau, who's a GOP member from Rogers, who is authoring this bill with you, was also going to join us this morning. But as we all know, legislators are very, very busy right now. And so he got pulled into another commitment that he was not able to join, but wanted to send his regrets and share how, again, his excitement as well about working on this bill. So just wanted to highlight that as well. So just in the last couple of minutes here, Representative Coulter, do you have any final words that you would like to share with this group around this bill, around these issues, around early childhood in general? We would just love to have your thoughts.
I have a lot of thoughts. I won't share all of them. But first of all, I really do just want to thank you all for the work that you do. You obviously you are taking on the role of advocacy of stepping up for your fellow educators and advocating for them to those of us who are responsible for making the decisions. But more fundamentally, I want to thank you for the work you do as educators of our littlest. Our littles, excuse me. I am a parent of two young kids. I have a 6-year-old and a 3.5-year-old. And I get to see every day just how deeply, deeply important that work is. So I have to start by thanking you for doing that. Really, like I said, I literally started off presenting my bill on yesterday, by saying that I'm excited because I am. I am really, really excited for the direction that we are moving in. And, I think we often talk about licensing and some folks I think see it as, well, if we can reduce that burden, that's going to save money. That's going to bring down the costs of childcare. And I think I think we're to a place now where we see that there really aren't sort of direct financial costs. Like it's not like we can say we get rid of this or we change this and this is going to save providers or save parents X dollars. I think we know that. But really sort of the broader goal here is to recognize that by putting in a better system, a system that supports providers, that, like I said, treats you all like the educators you are, that we can make life easier for you. And we can center the joy of serving our youngest Minnesotans and serving Minnesota families in the work that you do, which is why you all got into the business in the first place. And by doing that, that's going to keep more folks in business. And that will help to bring down costs. But by doing that, we are just continuing to show that we are all focused on prioritizing Minnesota kids and Minnesota families. And you all know this, and I ended my presentation with this too. But when we remember the fact that 80% of brain development happens by age 3 and 90% happens by age 5, what could be more important than that? So really, again, just thank you all so much for being here. Thank you for having me.
Thank you so much. And what a great way to wrap up this conversation. Again, thank you, Representative Coulter, for joining us. I know you are all very, very busy right now. So, and with that, I want to thank everybody that was able to join us. Candace Yates, Marika, Deb, Maria, Kristen, just a wonderful, wonderful conversation. And we're so thrilled to have, again, this is the start of a conversation. We are at a place where we're starting to think about what the possibilities are. And this was an amazing way to spend a Friday morning with all of you to explore what that possibility could be. As a reminder, we are very committed to continuing this conversation. And as one step in that process, we will be getting a recording of this event to everyone, as well as additional answers to the questions we weren't able to get to. There will also be a survey that is coming out to all of you, and share that survey widely, right? Like we want to get everybody involved so that we know how to best keep this conversation going as we are all moving towards, and I'm just going to pick up on what Representative Coulter mentioned, really how are we making sure that our youngest Minnesotans really are getting all that they deserve, that our educators have the supports and the resources that they need, and that families also are appropriately paying based on their own economics. And so with that, thank you all for joining us and have a wonderful, wonderful weekend.